Frontal bossing is when someone has a very noticeable forehead, with a stronger brow ridge. This can sometimes be a sign that a baby has a rare syndrome, which can affect their bones, hormones, and overall growth. Frontal bossing can be caused by rare conditions such as hormonal disorders, genetic syndromes, or other factors. One common cause is acromegaly, a hormonal disorder that results in the bones of the face, skull, jaw, hands, and feet becoming enlarged due to excessive growth hormone release from the pituitary gland. Other rare genetic conditions that may cause frontal bossing include basal cell Nevis syndrome, Gorlin syndrome, Crouzon syndrome, cleidocranial dysostosis, cleidocranial dysplasia or CCD, Hurler syndrome, Pfeiffer syndrome, Rubinstein-Taybi syndrome, Russell-Silver syndrome, Russell-Silver dwarf. Frontal bossing can also be caused by congenital syphilis in babies born to infected mothers, as well as by taking trimethadione, an anti-seizure medication, during pregnancy. After birth, rickets, which is a result of vitamin D deficiency, can also lead to frontal bossing, slow growth, and soft skull bones in infants and young children. If you notice that your child's forehead looks larger than normal, it's important to see a doctor to find out if it could be caused by another medical condition. The doctor will diagnose frontal bossing by doing a physical examination and asking about your family's medical history. They may also ask when you first noticed the abnormal forehead and if there are any other symptoms. To confirm a specific condition, the doctor may order laboratory tests. Imaging tests like X-rays and MRI scans can be done to check for any abnormalities in the skull. Blood tests may also be used to check for genetic conditions and hormone levels. Frontal bossing cannot be treated on its own, but the syndrome possibly linked to it can be managed. Your doctor may recommend different ways to do so. One option is cosmetic surgery, which may be used to manage frontal bossing. A small study on forehead reduction surgery found some side effects, but these disappeared within a year. However, there are currently no specific guidelines for the surgical treatment of frontal bossing. If you're concerned about frontal bossing, there are some precautions you can take before your baby is born. Genetic counseling is one option. This involves a healthcare professional helping you assess the risk of your child being born with certain rare conditions. You can also consider genetic testing, such as carrier testing, to see if you or your partner are carriers for specific genetic conditions. Prenatal testing using amniotic fluid can also be done to test unborn babies for genetic conditions. Additionally, consider getting tested for syphilis while pregnant. If you test positive, you can be treated with antibiotics to cure the infection. If you take anti-seizure medication, make sure it is not trimethadione. If it is, ask your doctor about switching to another medication during pregnancy.